The School of Health Professions and Human Services at Hofstra University is a dynamic center of learning where students become both experts in the science of their specialty as well as compassionate clinicians and advocates who make a difference in the lives of others. We offer more than 24 undergraduate and graduate programs in health professions, speech-language hearing sciences, and counseling and mental health that prepare you for careers in health or advanced study in a broad range of clinical professions.
Hello, everyone, and welcome back to the second seminar of day one of the Long Island Healthcare Forum, powered by our friends at Hofstra University. My name is Ali Jabbour, and I'm the Associate Publisher at Long Island Business News. Welcome back. Our second seminar focuses on COVID-19’s effect on mental health. Not only the mental health of the healthcare workers, but their patients and everyone involved. We will explore the topic from the perspective of both the aging community and our youth. To discuss, let's welcome our speakers. Kate Schneider is the Programming Specialist for Reflections at the Bristol Assisted Living. Hi, Kate, how are you?
Good morning, I'm
welcome. Welcome. And please help me welcome Regina Barrows Rivera. She's the Associate Executive Director of the North Shore Child and Family Guidance Center. Hello, Regina. Good morning.
Good morning. Thank you for having me.
And let's bring on today's moderator, our very own Jenna Natali, Events Manager right here at Long Island Business News.
Good morning,
hey, Jenna.
Hey.
All right, ladies, the floor is all yours.
Thank you, Ali.
See you later.
Good morning, ladies. How are you?
Good morning.
Kate, Regina, thank you so much for joining us today. I'm so excited about this conversation because I think that what's really fascinating and unique about having both of you on together is that you've both been working with arguably the most impacted age groups that are really on two opposite ends of the spectrum, right? And, you've been addressing not just their physical well-being, but their mental health while keeping your staff on track so that you guys can provide those services to the communities that you serve. So I'd love for you guys to kick it off by, sharing with me, what did you see as the acute mental health effects on both your patients and your employees that you experienced while working at your organizations at the start of the pandemic? And Regina, I'd love to have you take it away.
Thank you. So what I think has been the most critical and continues to be is the fact that this virus is like a war. It's like we're at war with this invisible enemy. And we, the helping profession and our clients, are hit in the same way. So we don't know where this is coming. We don't know how it's going to hurt us. And it has forced us to work completely differently very quickly. Because as you know, in March, we were hit hard. Many of our staff got ill and our clients got very ill. So we had to change from working in person with the children and families who we see in the office to working telehealth, which was new for the majority of our clients. We quickly transitioned to using telehealth as a method of working with our children and families.
Right. And I'd love for you to touch, Regina, just for anybody who's not familiar with your organization, what type of children do you generally work with? Do you mind just explaining that for the audience?
So we're a community mental health agency specialized for children on Long Island. We have 3 offices, Manhasset, Roslyn, and Westbury, also in 3 school systems with BOCES. And our children range from 0 to 24. We work with them in outpatient mental health, and we also partner with BOCES on an intensive support program in the school, again, from the elementary school to the high school. We work with moms postpartum, as well as prenatal, offering their care for that as well. So it's depression, anxiety, children who have been hospitalized for psychiatric problems, also children at risk for suicide and depression, anxiety. All types of calls come in. We could move in quickly with emergency services, and we could also help the regular, what they call the regular emotional needs of children that are referred through schools, insurance companies, or family members.
Right. And I think what's interesting here is that you're working with already maybe an at-risk population, right?
Yes.
So kind of pivoting on that, Kate, can you share with us what you saw as some of the acute, mental and even physical effects that you saw with your clientele and then also with your staffing?
Hi, we work with people who are, it's an assisted living, so we work with people who are more independent, some people that might just like to have a little bit of supportive services. And also we work with the dementia population. So some of the things that we saw because of the virus was that people were unsure of what was happening. Things were constantly changing. People didn't even know what the effects of the virus could be or what works, what doesn't work in the very beginning. So there was constant change. So there was a little bit of frustration because of quarantining. There was loneliness, there was anxiety. So we saw that not only with the residents, but then the staff, and then even the families. So we really worked very hard from the beginning to support everybody. And we realized that our staff were really influencers. We wanted to make sure that they were comfortable so that we could put out that environment of we have calmness, we've got this, and there was great camaraderie and support for our families and residents.
Okay. Now, I think another thing that's interesting about both of you and the similarities maybe between two very different organizations is that you guys were both dealing with some moving targets, right? So on one end, Regina, you were dealing with openings and closings of schools that are right now we're rolling right back into that the same way we are, I'm sure at the Bristol, Kate. So Regina, what is it like operating, not knowing what your clientele might be experiencing on a day-to-day basis and even a regional basis, I would imagine, right?
Yes, so we went remote. The children were remote in March through September. So they were online doing online schooling, which would create a tremendous anxiety for children and their families, for their parents, especially for families who don't have the devices to help the children and support the children. So those children who had educational struggles and anxiety and depression and are terrified that they may die because they're hearing about this from the media, from March through June was very, very difficult. Mm-hmm. They didn't have school, all of that, but they were sheltering at home, kind of holding. Mm-hmm. And then in September, they think they're going back to natural, they're going back to school, they're going to be with their friends. And depending on if there's and they love going to school. For kids who were saying they didn't want to go to school, they couldn't wait to see their friends, they wanted to go back, and then they found themselves in a very different environment and one that could change very quickly. If you have someone that tests positive, the schools close down for a day or two. So you had to have that flexibility. Children thrive on structure, support, consistency. So when you have them with that constant movement, it creates tremendous anxiety. And can you imagine the poor parents? If they have to work, what are they going to do? And you're not bringing in help because you're afraid that if you bring in someone from the outside, they could have the virus. Mm-hmm. So parents these days, it's terrible. And then and I look at the seniors, you always, oh, thank goodness they have grandparents. Wow, they can't see their grandparents either. And we can't call them to come over to help. So it's very, very hard. It's a hardship for the majority of our children.
Right. What about you, Kate?
Well, Regina's right that consistency and structure is so important, I think, with any age. We're not remote, we're hands-on, we're in person all the time. Important to be proactive, which I think we did an amazing job at. So communication was key. Every time there was a change, in the beginning, the staff would be like, oh, in this morning it was one thing and this afternoon it's another. Roll with that. What I heard from the staff was it brought us closer because we were constantly connecting with each other so that we could bring that news to the residents. So we just being proactive and just monitoring that communication and getting strong with that made us excellent at what we did.
Great. Now, for both of you, are there any programs or ways that you maybe pivoted to providing your services, whether that's telemedicine or telehealth or technology? Tell me a little bit about, the after. So now we've absorbed what it's like to maybe not be able to keep our children in person, can't, do face-to-face meetings with our children, can't do so much face-to-face between families. Tell me a little bit about some programs and new things that you guys have put in place at your organizations, Regina.
Well, to tell you the truth, it's been hard because our children and families they really don't have the resources to get the kinds of devices that one might want them to be able to have. We do activities through using the telehealth. And if I could add, we're in September, we have a whole group of staff. We have 3 teams that went in person in September. So those staff people, the children that range from 0 to 18, 19, were able to see their clinicians, to see their therapist in person. So that's been great for the kids. But like I mentioned before, I don't know, we didn't mention the masks. Everyone's wearing the masks. And I remember when we were preparing for the school folks to go back, I'm like, they don't want to wear their mask. And I remember talking, I think to my boss, he said, well, you used the analogy, they have to keep their clothes on, they have to keep their mask on. I'm like, that's a good one. That's the one we use. You have to wear your mask. It's life-saving. You have to wear the mask all day. They walk around with masks, and it's really hard. It's a challenge. But I think when we were, when I think about it, I think about the incredible resilience that children have, the flexibility. When you push them to take something on, they are like, okay, if I have to, I will. And then they do, and they move in. It's almost like, if that's what we have to do, we'll have to do it. And maybe they'll have a little outburst or a little temper tantrum, but they'll wear their masks. And it is a lifesaver.
Well, I can share. I mean, all the young children in my life, all of my little cousins, they actually are very proactive. And sometimes they come to me and remind me before I walk in the supermarket. So yeah. I find that to be so interesting that, now psychologically, Regina, do you think that is there a reason why children maybe latch on to masks a little more than, say, like your middle-aged or adult?
I think it has to do with they follow authority. There's a concrete thinking, and okay, this is awful out there. We're terrified. We're afraid something could happen. Someone could die, and then we have a company.
Yes, I think that's our next panelist.
Okay.
We'll get back to you soon.
So they're so afraid. What do we do? So then the media, for everyone saying wear the mask, they're concrete. They're like, of course, why wouldn't we? Right. So they're like, it's an answer to a response to, maybe they can take charge of and feel like they can do something. Right. Interesting.
Now, Pete, I know this is almost your wheelhouse, right? What I love about the Bristol is that, like you alluded to before, you guys really, you service all kinds of older adults, right? From the people that are just looking for a couple little services here and there to fill a gap that maybe they don't want to put on their own children, to people that really need some day-to-day care. So what are some kind of programs that you guys brought in to try to bring up that mental health of the people who are living at the Bristol?
To say every single one of our departments, because isolation was a big thing. So each department did its part with visiting, checking in. Even dietary came up with Taste of the Season, and they came up with these beautiful, healthy smoothies. And we would incorporate recreation in that, and they would go through the whole building and just bring it to them. And they just loved that. Recreation, as far as technology goes, we really wanted to bring, like Regina says, people need control of things. So how could we invite the family in? How could we connect the residents with families? So the Facebook, FaceTime, Zoom calls, anything technology. Our regional recreation set up the community channel so that in each room there was community channels going on, so there was constant connection. the residents themselves checking in with each other. We have a program called Bristol Helping Hands, and that's how we support outside community and inside community. How could they support each other? So we recognize like physical wellness, mental wellness, emotional wellness. So a myriad of programs just to develop that. Just the other day, I got a video from one of the staff because it's Hanukkah, and they had the dining room director dress up, and he brought the mensch on the bench throughout the building, singing, dancing, bringing the gelt. And it's just, we want to keep normalcy as much as possible and bring joy to the residents. So each and every single department just really upped the game and supported the residents and the families and each other.
Hey, can you tell me, I'm just like interested in digging a little deeper in maybe some of your residents with cognitive, maybe cognitive deterioration. Are there any really interesting programs you guys have had success with that you find your patients really enjoy?
Because of the 6 feet and social distancing, we really had to concentrate on more dual programming, smaller group programming. So that was interesting in that we could do more of that. We also incorporate Eversound into our programs, which is a hearing device. So they're more inclined to use that in a smaller group environment. So we found that the smaller groups were even more beneficial than before.
Okay, that's great to hear. Regina, pivoting back to you, I actually have a question from a guest that's watching right now that wants to know, do you see an ethnically and racially and socioeconomically diverse population, which I believe you do? And if so, and this is a question I have, so I agree with you, Mr. Malakoff, what are some of the challenges you face working with such types of diversity?
Okay, well, the greatest difficulty we've had is that families don't own devices. And then if they have the school iPads or that they're really not supposed to use it for anything but for their online school. Some schools allow for a little more flexibility, but it's been terribly difficult to have family sessions. All the kids, they have these phones. So we've been having family sessions using the phones. And then you have to get 2 or 3 people into one screen. So that's been difficult. And then also with the low socioeconomic group of folks of all ethnicities, which range from, we have a number, we have African American, Haitian, Caribbean, new immigrants from Central America. They're, and they work in the helping professions for us, the supermarkets, restaurants, taking care of other people's children. So some of them immediately lost their jobs, and jobs were put on pause, so they had no income. And then as they started going out, then they didn't have people to watch their children. So we have young people, like the young teens, taking care of their younger siblings, and they're also supposed to be going to school online. Right. So it's been a terrible challenge. But again, I say they are resilient. We work with the telehealth, and actually our show rate for clients showing up to sessions is even better than when they come in person. They want us, they need us, they can't wait to see us. It's been months that they've been able to see us. We will see someone if they need to, if it's an emergency and we feel an in-person session's needed, but the majority of our clients are seen by telehealth. And if I could give people a sense of how many people we see over 1,000 children and families new in a year. Wow. So on the rolls right now, we have about 800 plus their family. So it's wow. Children and their families. We do a lot of services. And we're holding our own.
So you touched on something that I kind of want to pivot into, and that's that you guys are going back to doing some in-person, meetings. And Kate, I mean, your services are all essentially in person as much as humanly possible, right? So let's talk a little bit about the mental health of your staff members. So Regina, what is it like to send somebody into a house, especially since you guys, as you shared before, were doing telehealth for so long? So what is it like to prepare your staff for something like that, for such a big step?
So we put in place a system that we created here, Transition Back to Work team, which we started months ago. And it included educating the staff on everything that we're doing. So we slowly brought staff back into the building and showed all the changes that we do. And we said, you're doing telehealth at home. We volunteered for volunteer staff to come in and start practicing telehealth from the office. A small number, one a week, one person could do one a week. So it's been preparing them for a while. Those that had to go in home, we had special meetings for them, and we ordered as best as we could the protective gear. We feel like there's a wonderful staff person. She was actually modeling how you use the goggles, and we got the N95s, and you could cover your body because unlike another place that might be protected, if we called in for an emergency, that house might have many people in it with an outburst, with a psychiatric emergency that may need hospitalizations, and we try to prevent the hospitalization. So we would send our staff there fully equipped to deal with the emergency and not put them in danger.
Right.
So physical danger, not from any violence, but I'm saying from the virus. So
Right.
it's tough, yeah. But we're doing it, I think slowly now that we have this surge again, we were doing so well. We were starting to bring clients in, and now we're like, okay, wait a minute. Is that a good thing? So you have to figure out the risks, which risks outweigh
And I'm sure in a lot of ways your clientele kind of expects you to take the cues from their districts too. So I'm sure that's quite a.
And they trust us. If I say, listen, it's probably not a good time right now, they go, okay, all right, I get it.
That's good. Now, Kate, what about your staff? Because your staff is, in a lot of ways, has to be one-on-one with some of your your residents. So what has that been like to try to, steer the confidence within your staff members?
Well, to support the residents and, to deal with any isolation or anxiety, each and every department would go into all the rooms, so making sure that they had the proper PPE and most importantly, education. If they saw any changes in a resident, to make sure that they report that immediately so that we can provide the support that's needed. As far as staffing goes, there was anxiety there too. So again, making sure that they had, all the tools. A lot of the staff would say to me, coming to work than going to the supermarket. So they were comfortable with the policies and procedures that we had in place. We were very proactive, but we also had the employee assistance program. There was a hotline that anytime they felt uncomfortable or needed just some support, that there was a hotline they could call. But we also have an open door policy, which we always have in place, that at any time they could talk to their director or human resources. So that is there too. The residents, again, we were always checking in. We have the front desk even pick up that phone and they can call at any time and if they needed anything. I think maintenance used to get a little more calls than normal too, just to fix the clicker of the TV. But also the families needed something too. So we took all of our support groups and we made them virtual so that they could also check in with us too.
So that's interesting, the support groups, because I actually wasn't aware that Bristol did that. So have you guys seen an uptick in people looking for services like that?
Absolutely, yes.
Yes, us too.
Yeah, our attendance, being that it's virtual, it's safe, it's convenient. So we've definitely seen more attendees to that. So it might be something that will continue.
Yeah, and we offered community workshops to the community, just not non-clients, just we opened it up. We had about 5 or 6 community parent groups offered virtual for anyone who was interested. We publicized it on our webinar and our staff volunteered to offer the workshop. So we had a series of groups for parents that needed the support.
So it sounds like both of your clientele might potentially be growing, which really must be a task on your staff. I mean, is there anything, so you guys spoke a lot about making them feel secure, right? Which I think is very important because I think first and foremost in both of your organizations, the fear of contracting and passing along to the next, knowing that you're dealing with high risk communities. I mean, Regina, you work in a lot of socially diverse populations that may have intense outbreaks. And Kate, you work with some of the highest risk people, on the planet. emotionally, are there any tools that your organizations are providing mental health wise, or is there any instances of your teams banding together? Because we talk about resiliency, right? Children are resilient, and the elderly are resilient too. They rely a lot on habit and being able to count on something, whether it's a mask or something to that nature. So have you seen an opportunity for your teams to grow closer?
You know,
Absolutely. Go ahead, Regina.
that what we network with community services, and that has been also an area that we have been challenges, because the school district, they're our partners and they're struggling. So we're trying to really keep that piece intact, because if they're doing it in person, they can run groups, they could offer support groups, they could communicate with us. So all of like the multiple systems in the community that we've for years have established very strong working relationship also have been, I don't want to say severed, but they've been impaired. And so we're in kind of in a repair at this
Right.
period.
What about you, Kate?
I think that, we, in our community, we have so many different departments, and I don't think each department gets the recognition they deserve. So I found, working in the communities, housekeeping gets the high five all the time. We really, really appreciate what they do. Sometimes you don't understand another, department's role, but definitely see the staff supporting them. Those team members that worked with the residents who had active COVID, to see the staff go up to each other and do that virtual high five and just the smile and just saying thank you to each other. It's from everybody that I've spoken to in our communities, what they keep saying to me is we've become closer, stronger, and more appreciative of each other. And it's nice when you see the residents too, like we, for Thanksgiving, a grateful tree, and everybody wrote what they were grateful for. And it was such positive things that came from this. So I know there's so many negative, but we really tried to accentuate the good that can come out of these things. Families with the supportive notes and the lunches and the little boxes of chocolate or something, just to let the staff know that they appreciated it. It really meant a lot to them.
And if I could add, our children, as children, they thrive on the rituals that hold their year together. And as you know, they lost their birthday parties, their proms, their graduations, every step of the way. Every time something like that would come up, there was a creativity that was needed to help fill that void. I must say the virtual, we've become quite good at it, where you can celebrate birthdays, you could have virtual parties. Our staff have become really good at this, and it's become even interactive right in the beginning. And then working on figuring out how to help the families celebrate those rituals that are so critical to them in their life. We don't realize, when you look back and you think kids that got onto a team, they couldn't wait to be that player or to play, they lost that sport. They lost that position. They lost that place in the play. I have kids that love orchestra and singing and dancing. They've lost that. So how do you bring it back? I've had groups where my group bring out their instruments and they play with each other. They interact using a Zoom, and I know the schools have become very creative in using the Zoom as well. Well, I should say telehealth. Not telehealth, the online screening to help them with that. It's been a challenge.
So I see that we have 1 minute left, and I'm going to ask you a question that didn't make it onto my list until very recently, and we're having a seminar on it later today, but I really want to hear really succinctly. This morning we're hearing that a vaccine is very, very, very probable, right? And that we're getting shipments into the United States. What kind of effect will that have on your organizations and the way you can serve your patients in the next, say, 3 to 6 months? Kate?
I guess it's just hope that, that there's a light at the end of the tunnel, and that this will be available to the staff. Everybody will feel a little bit safer. But I guess just hope and feeling a little safer.
What about you, Regina?
What I would say is I will launch the biggest educational piece to inform our children and families that if you trust us and we want to trust the medical field, we got to do this together. You know, we're in this together. We're going to have to be in this together because we can't continue like this. So that's what I would say. Let's listen to the science and let's do an educational piece so that we could reach those families that are in that percentage that don't trust us.
Thank you, ladies. Regina Barros Rivera from, excuse me, Associate Executive Director of North Shore Child and Family Guidance Center, and Kate Schneider, Programming Specialist for Reflections at the Bristol Assisted Living. Thank you so much, ladies. Everybody, we will be back very soon with our next seminar. So until then, stay tuned for a short break.
Thank you.